Bienvenidas todas las personas
Welcome
que nos...
all those who are joining us.
Bienvenidas todas las personas que nos acompañan en este foro especial, Economía y Salud.
All who are joining us in this Health and Economy Forum,
que tiene como objetivo analizar el vínculo entre economía y salud,
study the link
la
between
soberanía
community
sanitaria
health
y los
sovereignty,
desafíos para la
and
recuperación
the
económica.
challenges for economic recovery. We're celebrating 50 years of the Andean Health Organization, of the uninterrupted work, joint efforts, and articulated with the Ministry of Health of the 6 Andean countries, Bolivia, Chile, Colombia, Ecuador, Peru, and Venezuela, to promoting the guarantee. We invite you to give us your name, organization, and country in the pop box or the Facebook Live or YouTube live chat. At the same space, you can leave your questions or send it through the email webinarhorascondo@gmail.com. We will start with the institutional greeting, followed by the presentation of our speakers, and then we'll go to the Q&A session. In order to receive your certificate of attendance in any of the chat or the Facebook Live for YouTube Live, you will find a link that you need to complete, leaving your data, which issue the certificate that will be sent to you to your email in your next days. To speak in this important day, I give the floor to Dr. Maria Carmen Cayetana, Executive Secretary of the Andean Health Organization, who will give the welcome and institutional greeting. Go ahead. Thank you very much, Bertita. Welcome to all who are with us in this Health and Economy Forum and the Andean Health Organization Hipólito Unanue, carrying out in coordination with the sub-regional of the Pan American Health Organization. In Horas Conhu, we have the health and economy since 2008 made up by representatives of the 6 countries, Bolivia, Chile, Colombia, Ecuador, Peru, and Venezuela, with the goal of contributing to generate proposals for the improvement of health investment that has incidence on the equity and social and economic development under the frame of sub-regional integration. And for 17 years, we've been able to find a permanent and initiatives and forums research in this area. Today, in the forum, we will analyze the links between economy and health in the current context of the pandemic that is still in force and goes beyond the transmission and mortality excess. We will analyze the evidence of structural weakness of the health systems, the financing, low public expenditure in health and high out-of-the-pocket expenses, segmentation, care, and fragmented organization, and the link with the implemented reforms. We will also reflect on the health crisis and the impact on the economic and social development. The impacts of the pandemic reproduce and increase inequalities, and for that reason, talking about syndemic and the need to have the intersectional analysis in social groups that are most affected. For example, it is evident the unequal impact in children and adolescents. 9%, 2.2 million, without routine immunization in Latin America and the Caribbean, more affected by poverty and extreme poverty, with mental health issues, poverty in education due to the consequences in classroom interruption, and a longer period of total or complete closure of education schools. undoubtedly, the pandemic is still the highest risk for the economic, and the impact is affected by the unequal access to vaccine, test treatments, and personal protection equipment among between developed and underdeveloped countries, and among the same countries in Latin America and the Caribbean. In 2020, more than 4 million people throughout the world didn't have social protection. And in 2022, between 75 and 95 million people live in external poverty, in poverty. Latin America and the Caribbean have become the epicenter of the COVID-19 pandemic and is a leader in the world statistic cases, with a resultant social economic crisis. And if we don't take urgent measures, this could become in a food crisis, which is already in course, and also humanitarian and political crisis. 2.5 years after the start of the COVID-19 pandemic, we are dealing at a high uncertainty, economically speaking, due to the health crisis and other world phenomena such as the war in Ukraine. The structural inequalities reflected in the unequal distribution of social determinants for health of the countries in our region, increases the possibility of transmission and deaths due to COVID-19. The combination of multiple crises and interrelated to where we haven't faced the climate crisis and the repercussions of the Ukrainian conflict repercussions is putting at risk the viability itself of reaching the SDGs for 20. Everything that I've said evidenced the need to reform and reinforce the health systems and intersectorial efforts, improve social protection to reduce social inequalities in health and the impact generated by the pandemic. The pandemic is an historical opportunity to debate, promote, and implement the necessary reforms to guarantee. The analysis of the course of the pandemic tells us and is evidence of how important is health for the economic, social, and sustainable development, and the profound interdependency that exists between the social, economic, and environmental dimensions, and therefore the need to have comprehensive health policy. We need an urgent effort to rescue in order to achieve a rapid change of course on the basis of a comprehensive response to this interrelated world crisis and a renewed compromise with multilateralism and international cooperation to deal with the pandemic in all its phases. Health, social, and economic policies must be integrated, coordinated, and adapted to the national and subnational context, have to be guided by principles that are fundamental. According to these principles, life, health, and well-being are of utmost importance and are a prerequisite to reactivate the that all the mitigation policies in terms of health and economic must be very important to strengthen the first level of care, primary health care, the essential functions of public health, and the actions of social determinants for health. That should go together by policies that coordinate health systems with social protection systems that must be universal and must be sustainable under the frame of comprehensive care and well-being states with central access in guaranteeing the right. We need to promote health with multi-sectorial actions and to strengthen partnerships. Without health, there's no sustainable development. Welcome Paolo Valadelli, Carlos Cadelca, Ernesto Vascolo, Claudia Chamas. Welcome all of you who have joined. At this moment, I have the honor to give the floor to Dr. Paolo Valadelli, who will be in charge of moderating the rest of the forum. Well, I don't have to introduce Don Paolo Valadelli. We all know him, and we thank you for this joint effort that we're doing between the Horas CONU and PAHO in a very special manner with a sub-regional problem for South America. Paolo, it's a pleasure to be part of this. Thank you, Mari Carmen. Good morning, welcome all. Bon dia, bon tarde, good morning, and good afternoon, everybody. We're today linked through Facebook to a large audience. I'm very grateful for you.
Not only interesting, but really key to define strategies and political commitments. La dottora Carissa Etienne, direttore della OPS.
Dr. Carissa Etienne, head of the PAHO for the Americas, sends her greetings and congratulations to Horas CONU, to the Executive Secretary Maria del Carmen Calle, and to the delegates from the member states, ACE in particular, the Andean Health Organization, Andean Health and Economy Organization, the countries such as Bolivia, Colombia, Chile, Ecuador, Peru, and Venezuela. With this important discussion, we would also like to bring the greetings from the team of the Sub-Regional Program for South America, of which I am currently the Deputy Director. Today, we have with us the very close friends who fight for public goods in health and economy. They are the top leaders in the topic we're going to talk today, and they're going to guide us in our approximation. I will name them. Dr. Carlos Gadella, coordinator of the Center for Strategic Studies in Fiocruz, Brazil. Dr. Ernesto Vascolo, regional advisor in governance, leadership, policies, and planning in health of PAHO WHO, and Claudia Chamas, senior researcher in health and intellectual property at Fundación Osvaldo Cruz Fiocruz. As Dr. Calle already mentioned, from PAHO and Horas, we prioritize the indivisible relationship between health and all other sectors, which is why we have organized this important forum, whose ideas was born after the seminar on economics and health in the framework of the course on global health and health diplomacy organized between PAHO and Fiocruz. Today, in this forum, we coordinate important topics: health, sovereignty, and a way out of the COVID crisis, economy and health for all, and the international regulations on intellectual property. This forum is taking place while the world continues to face extremely serious challenges, from the COVID-19 pandemic to the climate change crisis to growing inequalities and social divisions. The current war in Europe, in Ukraine, all these phenomena are taking an enormous toll on our society in terms of quality of life, loss of life, and economic. And who are the groups that are the most in this context? It is the poor and the most vulnerable populations who are being most threatened by severe social and economic disruption. I just came back from an important mission with OTCA, Amazon, the heart and the lung of our planet, in the border between Ecuador and Peru. 1 week of visits to areas with extreme poverty and major challenges. In fact, the recent report from the United Nations on the progress towards the SDGs indicate that the multiple global crises will lead to an increase in people living in extreme poverty by 2022 between 75 and 95 million. The 2022 high-level political forum we held in New York in July 2022 in the ECOSOC segment evidence how the pandemic has reversed the efforts to achieve the SDGs of the 2030 agenda and emphasizes the urgency of building back better and as sustainable and inclusively as possible. The current situation also calls for urgent measures on multiple areas, interconnected among them. For example, the epidemiological front and health systems, which must be strengthened in their capacity to care for vulnerable populations. The economic front, which requires policies and rules of equity and sustainability. Labor market front, which must offer guarantees of respect for rights in addition to a healthy productivity. And the social protection front, which requires opting for integrated, intersectoral, and sustainable system. Finally, the environmental front, defending our planet for a sustainable development. In other words, regional, global, and national measures are urgently needed for equitable and sustainable economic recovery, integrating health, economic, and social health policies. The pandemic has made even more visible the close bidirectional relationship between economy and health. Health of the population is an essential factor for economic growth and development that may have an impact in poverty reduction and vice versa. In fact, without health, there's no economy and there's no development. It requires a multi-sectoral action based on strengthening partnerships and prioritizing the most vulnerable groups. These ideas and the intervention of Dr. Calle during her institutional greeting provided us with relevant content on this important topic, we cordially welcome the first speaker, Dr. Carlos Gagueya. Before that, I would like to tell our dear audience that Carlos holds a PhD in economics from the Institute of Economics of the Federal University of Rio de Janeiro. He is currently coordinator of the Center for Strategic Studies in Health, CEE Fiocruz, coordinator and leader of the research group on development, industrial economic complex, and innovation in health of the Fundación Osvaldo Cruz Fiocruz. He is professor and researcher of the Department of Administration and Planning of the National School of Public Health, Sergio Arouca, with a long career in different positions of science and technology. Today, Carlos presents health, sovereignty, and way out of the crisis, a perspective of the health, economic, industrial complex. Go ahead, dear Carlos, you have the floor.
Muchas gracias.
Very much.
Eu queria saudar a doutora Berta Luz, Maria del Carmen, Paulo, que já posso falar como meu amigo. Ernesto, Cláudia Chama.
There is not going to be any English interpretation in this Portuguese presentation.
Pedindo desculpas, que estava preparado para falar em português e vou falar em português, porque a tradução não está operando. Mas meu portunhol é incompreensível se não me preparo antes. Então, vou falar bem despacio, em la esperança de que possamos interagir a partir de agora cada vez mais. O tema que vou tratar é um outro ponto de vista dos determinantes sociais da saúde. Se, de um lado, os determinantes sociais, como a questão da fome, da habitação, do saneamento, são essenciais para a saúde, de outro lado, a saúde hoje se configura uma das áreas mais importantes da economia e da inovação e da quarta revolução tecnológica. E a grande tese que nós desenvolvemos há 20 anos na Fiocruz e que se tornou uma política pública vigorosa, o Brasil produz vacinas por conta desta política pública, 300 mil vidas foram salvas, a despeito da tragédia de quase 700 mil mortes pela Covid, mas foram salvas fruto desta visão e desta política pública. Na verdade, a grande tese e que eu trago para a discussão regional, hoje estamos avançando esta agenda do nacional para a dimensão regional e a dimensão global. É que sem uma economia em saúde forte, nacional e regional, nós não teremos acesso universal à saúde. Não podemos ser uma região dos países andinos que produz apenas commodities, petróleo, soja, cobre, e que, quando tem divisas, importam medicamentos, equipos, inteligência artificial, big data. É insustentável não ter uma economia regional forte no campo da saúde. Para facilitar a compreensão, me desculpando de novo que não trouxe os slides em espanhol, eu vou apresentar aqui os slides que vão facilitar a compreensão dessa visão. A perspectiva é pensar justamente a saúde como uma área estratégica, um novo vetor para o desenvolvimento regional, como porta de entrada num padrão de desenvolvimento que seja socialmente inclusivo e ambientalmente sustentável. Parto aqui da visão de desenvolvimento de um dos maiores economistas da América Latina, Celso Furtado. Ele caracteriza o desenvolvimento econômico. Acho que a gente está numa época de ter autoestima pela nossa região. A definição dele de desenvolvimento é superior a qualquer outra disponível na literatura global e ainda continua pertinente. O desenvolvimento econômico, deixa eu tentar colocar aqui um apontador. O desenvolvimento econômico está relacionado à inovação tecnológica, mas é um processo de mudança social para atender às necessidades humanas, e o próprio Celso Furtado depois estende para as necessidades de sustentabilidade planetária. Isto há mais de 50 anos atrás, vinha com esta visão. Nós fomos pioneiros na América Latina numa visão que associava inovação à mudança social, às necessidades humanas e do planeta, envolvendo uma forte diferenciação no sistema produtivo. O que nós assistimos hoje, e a vacina para a Covid mostra de modo muito evidente, é que não há mais nenhuma área da saúde que não seja um objeto forte de investimento, de interesse empresarial, de acumulação de capital. Perguntavam ao Jonas Salk, quando descobriu a vacina para pólio, se poderiam patentear a vacina. E ele perguntou, você poderia patentear o sol? 67 anos depois, o interesse do mundo real se revela de modo marcante, mostrando como quem não tem economia nacional, capacidade tecnológica e capacidade de inovação, não tem direito sequer à vacinação de sua população. Aqui eu trago uma figura do Facebook, ou seja, não é uma figura de um pensamento apenas crítico aos algoritmos, ao Big Data, que são bens que podem ajudar na saúde populacional, mas como é que esses algoritmos desenvolvidos fora das nossas regiões leem esse sabonete, que é o sabonete mais utilizado, pelo menos no Brasil. Mais de 90% da população usa esse sabonete. Lê como um pedaço de carne, um queijo, um pedaço de madeira, e só reconhece este sabonete como sabonete. Isto mostra que, se não tivermos uma ciência e tecnologia, a ciência e tecnologia não é a cereja do bolo da saúde. Ela é o central, ela é, nas palavras de Cecília Minaio, uma grande sanitarista brasileira, a ciência e tecnologia tem centralidade nos sistemas universais de saúde. Essa imagem mostra muito bem uma sociedade altamente tecnificada, que entra na quarta revolução tecnológica, e eu sou um economista da inovação, a favor da inovação, a favor da entrada da nossa região na quarta revolução tecnológica, mas não para criar um mundo, em vez de moedas aqui, poderia ter vacunas. Um mundo onde é altamente desenvolvido do ponto de vista tecnológico, robotizado, e se dá apenas esmolas compensatórias, quando possível, para a população que depende, por exemplo, de vacinas. Em vez de moedas, aqui poderia ter vacinas. Enquanto o mundo tinha vacinado, os países desenvolvidos, mais de 70% de sua população, o Haiti não tinha vacinado em setembro sequer uma pessoa. E a gente viu os efeitos da assimetria do conhecimento e da tecnologia na saúde, por dentro da saúde, Eu não estou falando de causas externas, por dentro da saúde, como críticas para garantir o acesso universal. A perspectiva que trabalhamos é que temos que lidar com a saúde pensando simultaneamente a dimensão política, social, ambiental e da vida e a dimensão econômica da ciência, tecnologia e inovação. Não teremos o mundo da vida, do acesso, do direito, sem um mundo econômico, produtivo e tecnológico que dê sustentação. Essas três dimensões, a social, a ambiental e a econômica e da ciência e tecnologia, têm que estar integradas. Trabalhamos na ideia e estamos aqui, Paulo, queria anunciar, avançando neste paradigma para a dimensão regional, neste momento, em acordos internacionais de cooperação, já coloco a Fiocruz à disposição deste grupo e da OPAS para avançarmos nessa agenda de pensar este mega sistema econômico e produtivo que representa a área da saúde para pensar a escala regional. A saúde é literalmente um sistema que tem 4 subsistemas, de base química e biotecnológica, onde está a farmacêutica, de base mecânica e eletrônica, onde estão os equipos, os ventiladores, toda a área de serviços, que é uma área que mobiliza a economia e que representa talvez a parte econômica mais forte, mais expressiva do emprego desse sistema, e todo o subsistema de informação e conectividade. Esse subsistema foi desenvolvido mais recentemente na formulação teórica, e isso tudo virou política pública na experiência brasileira, iniciada em 2008 e que se estendeu até 2016. No Brasil, mas esses dados valem para a nossa região, temos a saúde representa em torno de 10% do PIB, gera em torno de também 10% do emprego formal, dos empregos diretos e indiretos. Hoje o Brasil tem um desemprego em torno de 13%, 12%, 13% da população está desempregada. A saúde é talvez a principal fonte geradora de emprego para essa população, e isto acomete toda a nossa região. A participação da saúde na pesquisa nacional e global é em torno de 1/3 da pesquisa e é uma área-chave da entrada na 4ª revolução tecnológica e industrial. Então, quando falamos da saúde, eu costumo dizer que a saúde é um dos grandes vetores do desenvolvimento, não é apenas uma cadeia produtiva, compensatória, acessória, mas sem a saúde ela se coloca com centralidade na perspectiva do desenvolvimento sustentável global, regional e das nações. Essa é a situação que mostra o déficit comercial. Na pandemia, no Brasil e na nossa região, isso se reproduz. O déficit vai sair publicado daqui a 2 semanas, eu disponibilizo. O déficit, as importações aumentam de 15 bilhões de dólares para 20 bilhões de dólares no meio da pandemia. Somos dependentes em insumos farmacêuticos ativos, equipos, materiais de proteção individual, máscaras, materiais essenciais para quem cuida. Nós não conseguimos cuidar de quem cuida por dependência científica e tecnológica. O campo das patentes, onde minha amiga Cláudia está aqui presente e pode falar muito aprofundadamente, é um especialista nesse campo. Os países desenvolvidos concentram 88% das patentes. A patente de hoje é a dependência de amanhã. Talvez na 4ª revolução tecnológica, se não mudarmos o quadro existente, não conseguiremos ter autonomia sequer para fazer uma vigilância epidemiológica usando Big Data, inteligência artificial e os conhecimentos da nossa própria população. Teremos que importar pacotes tecnológicos que não leem a nossa realidade. Como eles mesmos comentam, populações alheias à nossa realidade, conhecimentos alheios à nossa realidade, não conseguirão sequer interagir com conhecimento desenvolvido nos países de renda alta e crescente. O campo da inteligência artificial acontece a mesma situação, de forte assimetria, ou seja, a Fiocruz avisava ao Brasil e à nossa região: sem um complexo econômico industrial da saúde, teremos sistemas de saúde com pés de barro. Estamos avisando de novo: sem entrarmos na quarta revolução tecnológica em saúde, mesmo com os determinantes sociais avançando de modo precário, como sabemos, a gente não conseguirá garantir o acesso universal à saúde. Olha a situação do gasto em ciência e tecnologia no Brasil, como despenca no meio da pandemia, mostrando uma visão que precisa ser revertida, de pensar saúde e conhecimento e ciência como investimento. Esse é o retrato do Brasil, mas ele poderia ser o retrato de toda a nossa região. Eu prometi, no seminário realizado há cerca de um mês atrás, queria trazer o mapa da nossa região. São os principais produtos de exportação de cada um dos estados brasileiros. Todos os produtos primários exportadores. Nossa região está voltando a ser uma grande fazenda primária exportadora, que extrai recursos naturais, derruba árvores e não pode entrar na sociedade do conhecimento. Temos que ter um diálogo honesto e franco com os países desenvolvidos, que se tiver restrição de transferência de tecnologia, de cooperação tecnológica, nós estaremos condenados a sermos insustentáveis do ponto de vista ambiental e excludentes do ponto de vista social. E a responsabilidade é global, não é apenas dos países menos desenvolvidos e dos países andinos da América do Sul e da América Latina. A ideia para reverter esse quadro, não queria passar aqui apenas uma visão pessimista, é como a gente faz, e o Brasil foi pioneiro na primeira política social orientada por missões na área industrial e da ciência e tecnologia, como a gente pode articular a economia, o poder de compra do Estado, a ciência e a tecnologia para o acesso universal. O Brasil teve uma experiência do Ministério da Saúde dando uma política industrial de ciência, tecnologia e inovação para o acesso universal.
Disculpa, no sé si es mi audio, pero en este momento no estoy escuchando. Carlos.
Vocês me ouvem? Perdeu a conexão?
Ahora sí, pero antes hubo como 1 minuto y pico que no te escuchamos.
Eu vou voltar um pouco da fala para poder recuperar. Desculpa.
El último minuto.
Uhum. Tá bem. Estão me escutando? Estão me escutando? Não podia.
Perdón, Carlos, había saltos también ahora. No sé, hay un poco de instabilidad.
Estão me escutando ou não?
Agora sí.
Eu vou... Estão me escutando?
Agora sí.
Está dando um problema?
Sí, vai para frente.
Acho que vai... Eu vou tentar mais uma vez, Se não conseguir, me desculpem, problema de rede que eu não tenho controle. Vamos
Va
ver.
bene.
A ideia, então, é que se pode, e que a saúde no Brasil como um exemplo regional orientou a política de saúde. Estabelecemos um modelo, e o modelo nunca é um modelo único, tem que ser... Congelou de novo. Eu vou
Carlos, lamentavelmente, Carlos ainda tem problema de áudio.
Unfortunately, we're having problems with your audio.
Carlos, a sugestão...
Eu quero saber se vocês me ouvem, eu posso
Carlos,
terminar.
não. A sugestão é que podes, talvez, apagar o vídeo e continuar só com a voz.
Me ouvem? Como é que...
Podes ouvir-nos?
Quero saber se vocês me ouvem.
Neste momento, sim, mas
Eu vou só encerrar aqui com a mensagem principal para não atrapalhar o evento de vocês. Peço desculpas, ocorreu algo na rede aqui na Fundação Oswaldo Cruz. Eu não... Na verdade, desculpem.
não estamos ouvindo.
We cannot hear you, Carlos.
Acredito que temos que continuar com
We need to continue
o seminário,
with the program.
porque neste momento
At this moment,
provavelmente há problema de rede.
perhaps there's a major issue with the internet connection in Carlos.
Vamos continuar com o
So we will continue with our seminar because we haven't been able to reconnect with you. Well, we apologize for these technical difficulties. I think that we need to continue with our program, highlighting what our speaker explained, that we have important asymmetries that make that technology doesn't have access in all the continents and in all the regions. In fact, technology, as Dr. Gadella explained, is important, very important for the health system, and if there's no equity in the production of technology, there won't be equity in the access to health and well-being from these populations. He insisted that lack of access to technology is also related with social inclusion and environmental sustainability, and that the regional economy, and of course he was referring to the economy in the Americas, it is definitely important for the access to health from the populations of the Americas. Of course, during the COVID crisis, we had severe asymmetries between the different regions in the planet and populations. So not having that dependency in the industrial complex of the region implies to providing sustainability to health access to the populations of our region and vice versa. We will find with difficulties from the social inclusion of the population's perspective in terms of health, as well as the environmental unsustainability. This is a brief summary that the intervention from Dr. Gadella. I would like to take this opportunity to include two elements that I believe are extremely important together with this production autonomy, that are the global acceleration caused by an increase in the cost of energy and cost of food, as well as the rupture of the supply chain, disruption of supply chains, and the acceleration of market in developed countries are disproportionately affecting developing countries. And another issue that, since we're talking about economy and health, I think that it is important to emphasize that we need to define how to provide help for the foreign debt that would allow recovery, because without investment in the sustainable development goals, such as social protection, would not be anticipate a health for the populations in this phase in which we are coming out of a pandemic crisis. We are going towards a new global phase. This moment, I would like to welcome Ernesto Bascolo. Dr. Bascolo will present Economics for Health for All, Economics and Health Dialogue of the Americas. Ernesto is an economist and master in public health from the National University of Rosario, Argentina. He's a master in health economics and health policy from the University of Birmingham, and PhD in social sciences from the University of Buenos Aires. Within his vast professional experience, he serves as advisor in governance, leadership, policies, and planning in health of the Pan American Health Organization. Go ahead, Ernesto, with your intervention, and thank you very much for your participation.
Estás en mute, Ernesto.
Muted.
Perdón.
My apologies. Speaking about technology. You can see my slides, right? Yes, go ahead. Well, thank you very much, Paolo. And thank you for inviting me to this dialogue that I think it's very important for the entire sub-region. the dialogue between economy and health is a dialogue that goes across different dimensions. And I will try to make a review on the possible construction of bridges. What are the intersections between health and economy? In my presentation, in particular, I'm going to focus on the perspective of the health systems. I mean, governance, financing, and health services provisions, delivery, and try to identify interactions between economy and health. The first reference for us and unavoidable is the recent publication of the World Health Organization on the evaluation on the function of health systems. This is a classic framework a couple of decades ago, but has been updated with some innovations that we not only celebrate, but we were quite involved in this production. And when I say us, I'm speaking about the Pan American Health Organization, where we traditionally recognize four major functions as functions of the health system that had to do with governance, in some cases refer as governance and the financial aspects in health care services and the generation of resources. And this new version is much explicit, and I believe it shows new dimensions and indicators for the evaluation of these functions, considering not only the intermediate objectives and final goals, but a better idea of how this framework dialogues with some aspects of the context. In all of these large dimensions, the topic of health and economy have a very important role. I'm going to begin from the analysis, from the functions analysis. In those four functions, one of the core elements I want to highlight is the coordination. That is, it is not possible to think the dynamic of how health systems operate, not only including these four functions, but the analysis of the relationships among themselves. The aspect of governance has to do with the role of health authorities, but also all the governance structures that somehow define not only government spaces, but the rules of the game, the institutional frame. When we talk about service delivery, we're talking about a set of public health interventions. And here I will emphasize the other two functions, financing, that is more intuitive. Here we add those sub-functions that are classical of finances, such as resource collection, the integration of different funds to guarantee a solid allocation with solidarity, and the mechanisms of allocations themselves. Obviously, the available and the generation of financial resources, as well as the reassuring and allocation, have a clear component of economy that in many cases we express it in terms of health economy dimensions within the health systems. These are obviously the entry of the major discussions of health and economy. But I think that this dialogue that we're having at this moment with these presentations highlight this fourth dimension, which is the resource generation function. But here we have two types of resources, in addition to the financing, that are key for the health system to work and to guarantee its existence, and also determining those dynamics. And I'm talking about the generation of human resources, but also the generation of technologies, drugs, a large part of the industrial mesh that guarantees the existence of equipment, medications, vaccines, technologies that are part of the functioning of health systems. And although it has an significant intersectoral component, as Carlos mentioned before, this function of health systems of trying to guarantee the generation of necessary resources is, and it would be much more important, more determinant, the functioning of the health system dynamics and the autonomy or dependence that these health systems will have with regards to the possibility of generating these resources in an appropriate fashion that is sustainable and according to the health needs of each context. There's also an impact it's an impact on the intermediate and final goals, as I mentioned before. When we talk about the intermediate objectives, I would like to highlight that there is explicit reference to this in this frame in terms of effectiveness, equity, and also are stated in the final goals. But in the final goals, we are including financial protection as a topic that's not in, and here I try to reinforce the message that not only guarantees that the health system works in a more efficient way, there's its logic of guaranteeing access to health system by the population without considering their payment capacity. The element that has to do with access and equity to access health services, but also with regards to the component of equity in terms of financial protection, trying to avoid that the population becomes poorer when they use health systems. Of course, this element is linked to one and not the only barrier to health services that has to do with out-of-the-pocket expenses as one of the barriers to use health services. But as I said before, the dialogue between this framework of how these four functions operate in health systems and the context and the environment has many important interactions. The most obvious one, the first one, is that we cannot interpret the functioning of health system without considering the context issues. The context issues where one of the key elements has to do with the socioeconomic conditions. The element of socioeconomic conditions, in addition to the political and different, such as what has been the COVID-19 pandemic. The element of the socioeconomic context will favor or restrict the development capacity of those major functions that I mentioned previously. But at the same time, the dynamic of how these four functions coordinate in the system has an impact on the social health determinants. As we know, the social determinant is not an element that's going to impact exclusively on the final outcomes, but it goes in a transversal manner in terms of results and performance of the health system. And therefore, either the strength in terms of the developed rectory with health authorities, with the capacity of incorporate a mechanism of social participation and to generate accountability. And I'm talking about all those elements that are somehow attributes to this governance function, together with the possibility of generating resource in this particular space, highlighting technology, drugs, and different inputs, how these financial mechanisms flow inside the health systems are elements that are key and have an influence on the social determinants of health for the population. So how do we digest this in our region? And one of the most important elements to digest the strengthening of these four functions has to do with a recent resolution of Pan American Health Organization to strengthen resilient health systems. This is a fundamental element that has received much relevance, not only from the concept, but also from the practical and political perspective, assuming resilience as a fundamental attribute of health systems that are well developed and that work adequately to the existence of not only institutions and populations that are ready to face the crisis, but also all the key stakeholders that somehow react, strengthening those basic functions of health systems with the possibility of adapting and responding to the fundamental mission that health systems have, which is to promote health and protect the health of the population. And this in the health topic, it is expressed in one of the strategic lines to increase public financing for health and social protection. These are elements that I mentioned before that are expressed in the need not only to increase public financing, public expenditure in health, to guarantee the financial sustainability of transformation and strengthen these processes that are required for health systems. This also has an impact element that has to do with governance and very insignificant is within the health system, such as international sanitary regulation, but mostly in our region to guarantee the functioning of the essential public health functions that in our region we have a new operational and conceptual framework of those essential functions in public health as a vertebral column or backbone that the health authorities must have. But this is also in terms of prioritizing investment in first level of attention, improving expenditure efficiency, and as I mentioned before, strengthening the intersectorial action to improve social protection. This sometimes changes in a major commitment that we call the APS Pact, the 30-30-30, where we need to approach structural gaps in the short term to improve the equity conditions and access conditions and to increase the levels of investment in health at the first level of care. Even before the pandemic, things of course worsened even more after the pandemic, but even before the pandemic, we had significant challenges, right, of major progress made in health systems during the last 2 decades. We all have a very significant number of population that dies due to health problems that could be prevented. I'm talking about 1.7 million people every year, 1.3, 1.7 for Latin America. Although we have increases the coverage measured in different ways, this increase of coverage conditions not necessarily have reduced the inequity gaps or that coverage, even in countries and between countries. And some way we can deepen that inequality analysis is one of the most difficult things to solve that we still have in our region is how do we express the inequity conditions in the access to health services and by different reasons, as I mentioned before, either by equity in access when you compare the population with higher income and with lower income, 20%, where we still have significant gaps. But when we analyze that type of barriers to access, we realize that almost 60% of the population that doesn't use the health services when they need it, and the reasons are not only in aspects related to economic issues or an organization, but also cultural, language. There's a certain perception of health and disease. And finally, these elements, unfortunately, when people do use them, there is a significant out-of-the-pocket expense. It is also expressed in a catastrophic expenditure when they use health services. And to express the economic impact that the pandemic, the relationship between health and economy being dramatic. We all know that we've gone through a couple of years where the reduction of the income, the per capita income levels have been extremely large. And although we are trying to go back on the pre-pandemic conditions, the poverty and extreme poverty not necessarily go back to the phase before the pandemic. We are still in conditions that are worse as how we started with the pandemic. I'm going to try to go in more depth in one of the comments that I mentioned that has to do with public expenditure and the out-of-the-pocket expenses. Those fundamental situations. If we want to reduce the out-of-the-pocket expenditure, which is one of the barriers to use services when they are needed, and when they do use them, despite the important weight that this out-of-the-pocket expenditure has, these impacts in the impoverishment of the population becoming poorer. And here we see the inverse relation with out-of-the-pocket expenditure and current health expenditure. So the higher public health in either per capita or as a percentage of the GDP, we will have a smaller participation on out-of-the-pocket, and we will have better conditions against the barriers to access and less. Here we have a synthesis of out-of-the-pocket expenditure and public expenditure in terms of trends. Sometimes it's encouraging to see this drop in out-of-the-pocket when we analyze 2 decades and how that is linked to public expenditure. But unfortunately, we must say that in the last 6 or 7 years, the situation is stagnant, and we have an important challenge, therefore, to imagine a situation of sustainability in investment for transformation processes in the future. And another element that we'd like to highlight is that although we many times question the out-of-the-pocket expenditure because of this pro-cyclic component, things get worse. There's a lower participation of out-of-the-pocket when there's an increase in growth and there's an increase in out-of-the-pocket expenditure. We've many times assumed that the public expenditure should be contracyclic, and although it doesn't have that pro-cyclic characteristic as out-of-the-pocket expenditure has, we still have a lot to do in terms of budget policies, fiscal policies in health, to guarantee that when the economic solutions are more unfavorable, one has to guarantee levels of public financing that are adequate and sustainable. I'm going to go quickly now. This is a graph that includes countries from the region and has different quadrants highlighting two important messages. First of all, identify those countries that have improved this out-of-the-pocket expenditure in our region. We have certain public health, he corrects himself. We promote a public expenditure that is at least 6% of GDP, considering that countries of OECD with 6.7%. And we see that very few countries in our region are above that value. And on the other hand, another important indicator that has to do with catastrophic expenditure is to what measure the participation of out-of-the-pocket expenditure is reduced regarding to the population's budget. Very simple terms, the increase in the public expenditure in health not only has a solidarity component, but it guarantees the sustainability of health systems dynamic in the future. And when we try to break down the public expenditure and we recognize the different sources of resource, the different source of these resources, we must say that public expenditure that's financed through contribution from Social Security, and that public expenditure that is financed by the general budget. As you can see, we have a large mosaic where we have countries such as Costa Rica, who is a more important case where fiscal contributions do contribute. The contribution is the most predominant one that guarantees that financing. Then we have a number of countries, many of those have to do with the Caribbean, and also we have Brazil, which are the countries that are located on that horizontal group, where the most important weight of public financing comes from the fiscal efforts. And then what do we have? We have a major diversity of countries that have a mixed combination, and you also have to say not only mixed participation of the different resources, but at the same time, there's a large segmentation of different insurance systems. The countries of our region in the last 3 decades, I would say, be synthesized with this chart. In the 90s, in many cases in ECLAC and PAHO, we found evidence where the dynamic of the reforms of the country had to do with adjustment reforms, had to do with the need to reduce the state participation in health with very limited resources, focusing those policies on a specific population and with a limited package of services. Now, the last 2 decades were a real more expansive processes. Some reforms were focused more on development, expansion of insurance or coverage. And here we are on the right that quadrant of countries that have increased their insurance, such as Colombia, Uruguay, Dominican Republic are emblematic countries of this type of reforms. And there are other reforms that were not that national, and depending on the case, many of which had greater expression at the subnational level in states or provinces, such as in the case of Brazil, have been able to develop and have a national policy of one health system. And this has to do with using the public sector as a platform, while those that have promoted focal reforms for insurance have used a reform platform, social security. It is important because it is not only the difference between public and social security due to the type of contributions and the source of income, but also the populations that are included in that reform and the institutional characteristic of how this public system is set up. And we also have to highlight that there are reforms that go beyond these two typologies or typologies that are more structural reforms. Ernesto, you need to sum up. There are many questions. So then in the Q&A, 2 more minutes. I would like to highlight that what is seen in recent decades has had important impact in terms of the increase of participation of private actors, specifically in social security. There's been an important growth. Here we see some examples, not only expressing the significant participation on the name of the institution that have participated. However, the inequality to access to health systems not only has prevailed, but it have depended on the type of reforms. While we found increases in coverage in the insurance in those countries, that has not necessarily increased the conditions of access and reduced the inequities to the access of health systems. Primary health care is key. How we reallocate and prioritize resources, strengthening a capacity of resolution with primary healthcare approach is extremely important. When we analyze the time series, unfortunately, the reduction in access barriers is very important, and the socioeconomic context of the population is extremely significant. Countries with mid to low income, percentage of population that doesn't use health services when they need it is significantly higher when we compare with groups of countries with higher levels of income. And all of these has an impact on the health outcomes, that is, on preventable mortality, for example. Higher the barriers of access, the higher the mortality that can be prevented. And I would like, perhaps in the Q&A, come back to this, to the need to have a comprehensive approach, the perspective of essential functions that are based on the policy cycle, strengthening the capacity of health authorities and other key stakeholders within this health system to have a better possibility of evaluating the problem and developing policies considering important aspects of health economy, the allocation of resources by coordinating stakeholders with finances, with the industry, that are extremely important, and to guarantee the access not only to service, but also with an approach to social determinant with a better coordination between sectors. I apologize for exceeding my time. Thank you. Thank you, Ernesto. Ernesto, for the public, is our advisor in the Pan-American Health Organization for Governance, Leadership, Policies, and Planning in Health. And your intervention, I understand, Ernesto, is long because you have many topics in your basket that due to time limitation, I'm not going to mention, but there are many linked. In fact, to talk about financing without public financing, without talking about out-of-the-pocket expenditure cannot be done. To talk about financing without speaking of reforms is impossible. There are many questions here from the audience about the reforms. So later, we will talk about them. Also, the strategies that can be used for these structural reforms, or maybe reforms, partial reforms. Somehow, in your slide, you were already mentioning that there may be two types of reforms. But I think that the core of your intervention is the issue of equity and the difficulties due to the lack of quality financing and of segmentation, and also difficulties, as you mentioned, of integrating the different aspects, among them with the social determinants. All these results for the most vulnerable populations, an increase in the gaps and the inequities. So unfortunately, we have 2030 to achieve the SDGs, but what we are realizing is that we're getting closer, the closer we get to 2030, the larger these gaps are becoming. And I would also like to tell Ernesto, my colleagues, that the HORAS is working for several years with PAHO in a roundtable of an Andean roundtable of inequity that allows us to do a better measurement of where these gaps are located and what are the populations that are more far from enjoying the right to health. So we need to own instruments as they're being worked right now that will allow us to do an adequate identification of these gaps and what are the affected populations. So this can be taken into consideration in the definition of policies and programs and financing. Now, I would like to introduce the last speaker of this seminar, who is Claudia Chamas. My dear friends, I would like to tell you that Claudia holds a Bachelor of Science in Chemical Engineering from the Federal University of Rio de Janeiro, Master of Science in Production Engineering from the Federal University of Rio de Janeiro, and has a postdoctorate from the Max Planck Institute for Intellectual Property. Claudia is currently a senior researcher in health and intellectual property topics at the Fundación Osvaldo Cruz Fiocruz. And today, Claudia will present International Intellectual Property Regulation, Challenges for Economic Recovery in Low to Middle Income Countries. Thank you, Claudia, you have the floor. First of all, I will gonna put my screen.
Perfetto, se ve bene.
Bien, ¿no? Gracias. Buenos días.
Good
María
morning,
Carmen Calle,
María del Carmen Calle, Berta Luz, Paolo Valadelli,
Ernesto Báscolo
Ernesto
y bien, Carlos Gadella trae
and Carlos Gardella. I bring a message from Carlos. Unfortunately, his network connection is not stable, but he's going to be available for more dialogue and conversations and discussions on the regional. Good morning to my friends of the Andean Health Organization and from Pan American Health Organization, and good morning to everyone. And thank you very much for the invitation for this seminar. This is a major opportunity. I'm going to speak in Portuñol. I apologize, but I think this is going to facilitate understanding. The topic that I will present has to do with the regulation of intellectual property in the international setting, as well as the economic recovery perspective, especially in the countries of our region, in the mid-income countries.
Pandemia della COVID-19.
Since the start of the COVID-19 pandemic, there's been an intense movement in terms of intellectual property. And at the country level, there's been some adjustments in the legislation to face the challenges. One of the first responses was a number of operations trying to adjust the legal systems of countries such as Australia, France, Canada, Ecuador, and Brazil to improve or to implement legal measures, and the motivations were based on the uncertainty related to the technological production and the eventual limited conditions. These preemptive responses were added to the legal measures that were locally available based on the flexibility on the agreement of it. There was a proposal, as we're going to see later. And this is the main goal. And the proposal presented by India and South Africa ended up in a decision on intellectual property in the and this was based on a multilateral decision without forgetting some important facts such as interface with the area of health. Important that despite intellectual property receive a new trust with the agreement on ADPIC in 1990 that established minimal standards for protection. The products and pharmaceutical processes have coverage of patent, and World Trade Organization has a dispute settling mechanism that has to do with intellectual property with claims that involve some of our countries. It is important to remember that Article 7 of ADPIC established that the patent incentives research, technological research and promote transfer technology is with social, economic in rights and duties. Following this article, the International Organization of Intellectual Property had to provide a response to the AIDS world epidemic and the access to new antiretrovirals. And we had the threat in countries as Brazil, and also the Doha Declaration regarding the TRIPS and public health, and also the world strategy on terms of innovation, public health, and intellectual property of WHO. Here I bring data from the International Organization of Intellectual Property that there was an increase of patents in 1.6% in 2020. A substantial increase in the requests, the products that come from China, South Korea, the requests in India. It is important to understand that this effect that came from Asia was a product of the growing innovation to understand the complexity, the current complexity in that world that make decisions such as Doha in 2001 is not the same world that we're living today. With data from the WIPO, data that China, the US, Russia, Korea, South Korea, UK, India, and Germany entered more than 95% of the patent requests for vaccines against COVID. And here we go to the challenge of discussing intellectual property during the pandemic, which was a communication to WTO by the WIPO in October of 2020, where South Africa and India consider that the members of the WTO should work together to guarantee that the intellectual property rights, such as patents and others, do not create barriers for the access to medicine products, such as vaccines and drugs, in fighting against COVID. The proposal was known in Spanish. Exemption of intellectual property in English is known IP waiver, written in the heading. And this proposal received partial approval from the US. Catherine Tai, which is the US trade representative, mentioned that this is a global health crisis. The extraordinary circumstances of the COVID-19 pandemic call for extraordinary measures. This diagram, in this timeline, we see the evolution of this proposal, of the IP waiver proposal. The objective is not to understand the process in detail. If you want, we have quarterly reports with details in the Center for International Relationships for Health for the Osvaldo Cruz Foundation, organized by Pablo Bo, Sebastián Tobar, that generate this report in Spanish. All of this is available to the public. The most relevant here is to understand that this was a long process given the urgency that the pandemic for a response. Need had several counter proposals and difficulties that seem to be unsurmountable, mostly with Europe, with a large opposition to the original proposal. But finally, on June 17, 2022, the ministerial decision was achieved on the TRIPS that was adopted the Ministerial Conference of WTO, which is the maximum decision entity of WTO. This decision makes part of the so-called Geneva package. These are agreements, declarations, several topics: intellectual property, COVID, reduction of subsidies, food security, and among others, reforms. So this decision about intellectual property was not the only difficulty. WTO underwent severe critics by not responding to the timely demands, demonstrating that there was a relevant negotiation capacity of the institution in a context of weakening of multilateralism or the political action, disputes among China and the US, the pandemic, the war in Ukraine. And the idea was to have this negotiator capacity, the general director's objective. So this decision approved is a consequence of the link that we have between intellectual property and access to local production and accessible prices. We saw this during the AIDS pandemic and now the COVID. As we know, this is not new for anyone, and the difficulty to share technologies in the context of COVID. Technology that are many times subsidized with big resources. In the original proposal was the waiver of several provisions of agreement of the TRIPS in order to improve access. And the original proposal didn't have this geographic location. But after a year and a half, we have this package in many questions. The IP waiver still applies, but the measures that were approved are mostly the simplification of some procedures, but technically the decision in its initial part appears to ignore the agreement of WTO. This waiver is a mechanism considered in the WTO agreement and has been used several other topics, commercial topics. And here I will also allow to mention the ministerial declaration about the response of WTO to COVID-19 pandemic and the preparedness for future pandemics. I would like to highlight two things here. First, the countries remember that the Doha Declaration and they insist that TRIPS should not prevent that the members adopt measures to protect public health. And the agreement has to be interpreted and implemented in such a way that it will consider the rights of the WTO members protecting public health. And the countries reaffirm the right to use to the maximum the TRIPS and the flexibility to protect public health even in future pandemics. And the second point is the countries acknowledge that to increase the level of global preparedness to a pandemic requires to strengthen the productive capacity in scientific and technology capacities throughout the world, developing solutions for other public health crises, even those forgotten diseases. And technology transfer contributes to this development. So it was agreed upon that all developing countries are eligible for this WTO decision, but they promote and developing countries with capacity of manufacturing COVID-19 vaccines to commit to not to abide by this decision. And then the country may authorize the use of the object of a patent for production and supply of vaccine against COVID-19 without the consent of the title holder of this right through any available instrument. It could be an emergency decree, not an administrative order. The objective of a patent, there's a typo here, includes the ingredients and necessary process to manufacture a vaccine against COVID-19, and this agreement valid for 5 years. It is possible to think in export, and any proportion of manufactured products can be exported to eligible countries. This covers international or joint regional initiatives trying to guarantee the access, and it is limited to COVID-19 patents. Now, in the following months, we're going to have a decision to extend this to cover drugs and diagnostic tests. Well, at the end of this ministerial conference in WTO, where this decision was agreed, the head of WTO showed what are the positive impacts of this decision. On the other hand, many organizations from the civil society, as Physicians Without Borders, South Center, either that the measures are very limited. The India Prime Minister Narendra Modi and the chairman and the president of South Africa, Cyril Ramaphosa, celebrated this outcome following the G7 summit. And there was a press release from the Ministry of Foreign Affairs of India published following this meeting with Modi, with Siri, and they welcomed that. I'm almost at the end of my presentation. So the approval of a set of agreements and statements or declarations gave a new thrust to the WTO and also to the effort of General Director, especially in this amidst these geopolitical tensions and the multilateral trade system that has been affected because of the multilateralism crisis seems to get some thrust with this Geneva package. But as the newspaper, the Financial Times mentioned, the organization is still in vital support. There's nothing guaranteed. And I would like to show what I already mentioned. In the following months, we're going to have a new decision that's going to be taken as a consent. And here's a quick note to inform that the European Union and India have restarted trade talks regarding a bilateral agreement, and the question is still what intellectual property rules will be adopted in this agreement. And finally, for our institutions in our region, I think that intellectual property management can be improved continuously and contribute for the promotion of innovation and access to essential products and economic recovery. A solidarity-based function, and with the 2030 agenda, as it has been highlighted by our friend here, Paolo Valadela, who already spoke about that. To find this balance, we see there are many forces, conflicting forces. First, the monitoring capacity is critical. The following the institutional and political scenario for intellectual property, we need to be ready to face the Asian growth and also information of the content of patents for process of purchase of health products, decisions of evaluation for health technologies, access decisions, innovation decisions. It's also important to observe the experience of how China, South Korea, and the use of intellectual protection of their creations in order to profit with technical cooperation and local production. Intellectual property, not spontaneous generation without investment on a regular basis and amount, there's nothing to protect. The cooperation capacity. So finally, the use of the flexibility of TRIPS are possibilities that are available for countries. Let's see if the decision of the IP waiver includes drugs and diagnostic tests, will open new possibilities used by developing countries. Thank you very much. Thank you, Claudia. I remember that Claudia is the senior researcher in topics of intellectual property and health in the Osvaldo Cruz. I thank you so much, Claudia. You've spoken in Spanish, facilitating the understanding and the interpretation into English. So thank you very much. And also thank you because your intervention that's quite complex from the point of view of those many relationships from a legal perspective between trade and health, access and innovation.
Realmente nos has dado un panorama
Given us a very clear scope by the complexity. I would like to synthesize in 2 words this intervention. I would like to say that once again, the focus, the approach that you've given us in important topics such as intellectual property, it's about equity. Also on solidarity, because what we've realized during this world crisis and with the COVID-19 is that we have been lacking international solidarity. That has created multilateralism and a number of difficulties in being able to express their mandate, because when there's no solidarity, we cannot do in an organized and balanced form provide an answer, considering the urgency of the crisis needed a quick governance system. I could say that there's been a lot of progress in intellectual property despite these major interests in play, and I would like you could confirm or clarify this plenary if from your perspective in the that we provide interest with intellectual property from the manufacturers and laboratories that has a commercial goal and the interest of the populations the consumers, indeed, where is the balance? If we are in an equilibrium point, or we still need a lot to do, if this balance is something that from your perspective could be done to get closer to that balance, to that equilibrium between dialectic tensions of those who have strong commercial interests and the population that obviously have the interest of survival. Now, why survival? Because the topics of intellectual property, despite that they seem to be cold topics, are really related with survival of the populations. And I will say indirectly also with peace. Because if the tensions, commercial tensions, and the commercial interests are extremely strong or disproportionate, that will later determine the difficulty of access of the population, that of course generates tensions and perhaps wars, because a lack, or at least a lack of peace. So as the British say, at stake here, we have a lot. So now I would like to open the plenary session. We are rather late in the agenda. In theory, we will have to finish in 4 minutes. So I'm going to ask the audience to stay 30 more minutes sharp. 30 minutes. Now we will finish with the closing arguments. So these will take 25 minutes to open this Q&A from the interventions of our dear and very brave, in this case, Ernesto and Claudia. I want to open this plenary session explaining to you, Claudia and Ernesto, and to all the audience and participants, that we have received many questions. And it's going to be a challenge that in this short time provide an answer to all the questions. And trying to simplify, I have broken down in 8 groups or many more. And because I'm the scientist and mathematician, I would like to divide the time we have, these 25 minutes left, in 3 minutes per group of questions. That means that you have a very limited time to provide your answer. It's quite telegraphic. Think well and don't get lost in too much narrative. So we will begin with, and also Claudia and Ernesto, I see that most of the questions are for Ernesto, but you can, Claudia, you can feel free and to answer and give your view. But the first, where each one of these questions also we could organize a seminar. So we're going to ask Maria del Carmen from Oras perhaps to go to later seminars with this question, because they're quite complex. Well, the answers. First question has to do with the right to health and the neoliberal model. That is what globally we all for good or for bad, we are somehow immersed in what Claudia presented, that we mentioned. We are in a neoliberal society, regardless of the ideologies of each one of us, and the inequities that exist generated by this neoliberal model. So the question is, can we achieve an equilibrium that would allow more equity and more rights to health without creating a different model from that neoliberal model? In other words, it's possible in this neoliberal model to reach a way of doing policy from the states that will allow to get close to a greater equity balance. And here I will associate another group of questions, second group of questions that is quite related is if we need to do reforms to remake the health system, or is it still viable to achieve a greater or better equity with partial reforms? How do you see this issue? Constitutive reforms that are complete, or if we can get closer with more partial reforms too? I will start with those questions. Ernesto, you have the floor. And then if Claudia would like to comment, and then we move ahead. Okay, these are not easy questions. I realize that. What I'm going to do, I'm going to react rather than response. First question is very interesting. My reaction is the following. It is possible to have health systems that are more equitable in different contexts. And in every case, we need to consider that the context of the social and economic development that each country has operates as a facilitator of a restriction to the solidarity and equity that that system has. In other words, if you could place the situation in a country with high inequity systems, the health system has limitations to become an island in conditions of equity and health and right to health of the population. That is why we should not think to draft strategies as if the health system operates in the vacuum. This question serves me to this is a restriction, but at the same time, I think that health systems somehow can be a generator to transform certain values, assuming health as a right, but also evoking human rights, different social rights to guarantee the right to health. We need the considering other social rights. So despite you limit the context, it would be so good that the debate on health will generate the production of social changes that go beyond health. Second question. Is it possible to move ahead in reforms that are structural, or with the partials is enough? I think that something needs to be said where we cannot think in debating or discussing about reforms without considering the political and institutional trajectories that the country has. We cannot think in a proposal for ideal health system if you're not considering the stakeholders that are seeking resources, etc. So I would like to respond it in the two ways. It is important to be ambitious with regards to your outcomes, but never without considering the previous trajectories. What is the institutional structures that prevail in that country? Otherwise, the risk of imagining things that would not land in political and institutional transformations that are feasible is big. I don't know if I was able to answer those two questions. Thank you, Ernesto. The question is quite complex. It's a seminar in itself, but I thank you very much for your reaction and not a response. Thank you. I ask Claudia, would you like to provide feedback to this? Thank you, Paulo. I agree with Ernesto. I think that health is a platform for discussion of equity, rights, of coordination and cooperation with other rights to improve access and equity. We have the pandemic with us, and we need to learn something with it. All the difficulties that we face as a country, as a region, are lessons that can serve to improve the systems, not just the level systems at the country level, but through cooperation, promote the regional integration. There's a lot of effort or work to be done. The question is quite difficult. I don't have an answer, but we may think in some path. And this balance issue is more and more difficult because the concentration of technological production is in the hands of few stakeholders, few countries. And we have a large change in the geographical distribution of technology, a proliferation of bilateral agreements and plurilateral agreements, and new players as China and other countries from Asia and India that has its mRNA vaccine as well as China. So this, now what happens with terms of access for our region? How are we going to have coordination with so many difficulties? I think that the platform of health from the public health perspective, with a perspective of a world public good, is important for the discussion of access and promotion of equity. Thank you, Claudia. And I think that I'm going to use this answer to look for a question that talk the focus on international cooperation among countries and South cooperation. So with regards to what you presented before regarding intellectual property, but more in general in terms of health access and the access to technology or access to research, etc. And I will start with you, Claudia. Just to round up what you were suggesting, how do you see the progress at this moment in the coordination between countries? Where do we see the challenges and any suggestions? Very short answer, please. one of the most important paths is cooperation, improving cooperation. Our region has to improve cooperation among ourselves. My opinion is not enough. We have more spaces, more possibility of widening and strengthening cooperation because we have the same goals. It's clearly specificity, but we have common problems in general, many problems related to access and investments in research and innovation. We can have much opportunity if we talk together in terms of investment and cooperation. My answer. I would like to take the opportunity and to all the audience to explain that at this moment, WHO and PAHO have launched a platform for increase the production of health technologies. In particular, in our region, there is a platform under construction, I must say, that is creating among countries with the regulatory authorities, the public-private industry, and several stakeholders, the possibilities of putting in all their experiences in common and have a significant impact to increase the regional production towards self-sufficiency. This purpose, we have major progress in Mercosur from the point of view of agreements in Horas, also in Prosur. So all the sub-regional integration organizations are working including the priority of this technological generation that would allow us in another crisis, but also we don't have a crisis, that the Americans have more capacity of manufacturing. We know that there are two hubs defined by WHO, with Brazil and Argentina, that are a point of reference and catalyst elements this increased regional manufacturing. Ernesto, would you like to add anything in terms of South cooperation? Three things. It is important, number one, and requires not only to build mandates and technical support instruments, but I also think that this is sometimes invisible, but it's fundamental to have common conceptions. We know that we have common values, but the way of moving them ahead requires approaches that are compatible, that are built collectively. These cases that you are elaborating are crucial for this. So the conception and approaches and actors that are participating in that collective construction are extremely important. The other topic, this is something that is not in the air. It has to do with certain structures that are practical, that can repeat themselves to guarantee that cooperation. Cooperation is not spontaneous. It requires certain platforms so they can be consolidated. That's all. Thank you. Thank you, Ernesto. With your permission, I will move to another block of questions that has to do, and I will start with you, Ernesto. Do we have specific strategies from your perspective that will allow to increase financing? And in relation to this, what about an approach of this financing with regards to central topics such as primary health care? Are there specificities in financing that would allow to improve primary health care? And the third thing is how to invest not only in recovering from injury, but also recovering health. Because many times the health investment is related to curative and not to promotion of health. I will start with you, and then Claudia would like to add something. Very short, please. This is a very good question. When the question is how to improve health financing, you should distinguish, number one, not only increase public financing. Of course, we have specific strategies. We need to increase public financing and make it more, with more solidarity. And one of the key elements has to do with prioritizing health in the fiscal capacity of each country. Number two, improve fiscal capacity of the countries to the possible extent with taxation systems combining contributing and fiscal factors, not limited to one against the other. And the second type of question regarding primary health care, the two types of response. We need to prioritize primary care. We need to redesign the budget strategy to strengthen the allocated resources to a first level of care with resolution capacity, but at the same time, not only more resources, but with a budget management with incentive that looks to have that financing with changes in the model of care. Financing is a condition that's needed, but not sufficient. The what for that financing is key. The reconfiguration of the care model is a matrix that should guide us on how to coordinate financing. And the third question that had to do not only with health services, but with health promotion. And the big response in this case has to do that the approaches has to be comprehensive. By that reason, the strategy of essential functions in public health that links and coordinates health systems for recovery with the policies of health promotion at the same time. Thank you, Ernesto. I don't know, Claudia, I have a specific question for you. Perhaps due to time limitations, I'll go directly to that question so you can have sufficient time to answer. It's a question that has two components. The first one is, how do we link research and social needs? And this is the title of your presentation, or could be the title of your presentation. Where is the equilibrium point between research and social needs? We previously mentioned the equilibrium or the balance between those who manufacture and profit from production and those who benefit, who are the ones who receive that production. And the second part of the question is somewhat more specific, that has to do with your presentation. And what do we need for vaccines to be recognized as a public good? Because although there have been some progress, in order to get to that balance, there's something that would have to be done. And from your perspective, what would that be? This is quite complex, I know, and requires much more time, but at least some thought. Thank you. I will start with the second question. They're all complex. It will take a new presentation. But How have the vaccines recognized as a global public good? When the pandemic started, there was a lot of statements and political statements from international institutions, regional institutions, that the vaccines are global public goods. But when the products arrive to the market, there we have the reality. With all the difficulties to access, those who had more money had much greater access. My phone. And that is linked with the first question. Have a balance of research with social needs. We need to be better prepared to reduce this technological dependence, because the countries that had less technological dependence were able to fight the pandemic problems. So I think that this issue of financing for investment and innovation with social interest are extremely important, and it has to be a global commitment. Because we have many problems in forgotten populations, forgotten diseases, with no insufficient investment. So that needs a reform, a new way of thinking on how to have a more rational approach and more solidarity. So that vaccines are recognized as a global public good. This model is not sufficient for that. We need more contribution from the South in technology and technological production, research and innovation and production. That's what I think. Thank you. Always due to time limitations, Ernesto, I won't give you the floor on this question because there's a final question. Very short answer, please. They want to know that you mentioned evaluation throughout the region of the reforms, of the impact of the reforms, out of the pocket expenditure, but mostly the evaluations of 4 dimensions and how we're doing in the region from the point of view of these evaluation instruments. Are we well in advance? Are there any barriers for the implementation of the evaluation? How can we improve in terms of evaluation, in financing, and all the elements related, and that would allow us to increase the efficiency of the systems and improving access, of course. Just a brief answer because we're in the final minutes of the meeting. First topic, in terms of evaluation, this is a fundamental function of the rectory capacity of the countries to evaluate their progress. Number two, we have more than we need evaluation tools, and the challenge is how to coordinate them, how to dialogue with these tools. We are working in our Department of Health and Services intensively with the countries, with most of the countries of our region, taking into practice by using these tools. What barriers? Well, the most important barrier for me, I have two. We're all responsible. First of all, sometimes the fragmentation of different initiatives, and therefore we need to know how to coordinate these tools so they can make sense and be coherent when we land or we implement them. Number two, strengthen that capacity of health rectory by health authorities. But I would like to mention that we're not doing bad, we're well. doing well with a major development in evaluation capacities, not only in present terms or retrospective, but with a world capacity to evaluate future scenarios. Done. Thank you, Ernesto, for being so short in your answer. I think we've come to the end of this important seminar. For me, it has been a very important and the final discussion with the presentations gives us some light that are quite relevant. It stimulates us and clarifies us how to work. Many times those who are in the combat field are the political volunteers, do things. And I think that you have given a series of evidence that are important. I would like to close or finish with some ideas of this seminar before asking our friend Maria del Carmen to the final close. I would like to reaffirm that despite of everything that has happened or why it has happened during the pandemic crisis, this is an opportunity to see what didn't work before the health economic crisis, and that allows us, if we do a proper analysis of the lessons we've learned, to rebuild and recover our socioeconomic and health system. The priority role of health and the economy must be reflected in investment. Sometimes I'm against using the term expenditure in health because expenditure is a negative word. I think that we should replace it so everyone, including the politicians, understand better its significance by talking about investment in health. And that is related with an investment in economic development and vice versa. That perhaps will get us out of the trap that the money that we put in health is money we waste, and modifying with a substantial modification of the deficit. We'll also, because we haven't talked about the topic, but mention that we cannot work in health systems if we talk about health without strengthening the resilience of the ecosystem. The ecosystems are critical to recover balance between man and the planet. That's the only home we have. Health is a balance with nature. Health is being able to have our home healthy so we can be healthy. If we don't invest in creating environmental conditions and a sustainable economic development, even if we had progress in medicine, this will be isolated and will not reduce mortality rates beyond a certain limit. In other words, we need to work in sectors. And I would like to close from a phrase by Abraham Horowitz, who was stated in 1961 to explain that 60 years have passed since Horowitz made this statement, still valid and may be a guide for all of us. And it's the following: and I quote, whatever the definition of economic development, its ultimate object is well-being. I think that may summarize what has been discussed today in this important seminar. And thank you very much to all of you from the Pan American Health Organization, to you, my dear speakers. Great. I've learned a lot. Now let's continue with our effort with energy and our commitment. Please, Maria del Carmen, you have the floor for closing comments. Thank you, Paolo. Well, we did it, Paolo. We agree and we thank you so much, because I think that this is part of the mission, sharing knowledge, share different ways, because at the end, I believe that we all have the same goal: if health, well-being, and a dignified life for everyone who lives in our region. My first words, well, these are not my first, my second words is to thank to those who have participated in this forum. First of all, Dr. Carlos Gadeila, Dr. Ernesto Vascolo, and Dr. Claudia Chamas. And very special to Dr. Paolo Valadelli for your excellent moderation. Just say a few things. I think we have discussed this topic, and so now we have to say, let's go to action. And we have very clear challenges: maintaining health, human rights, and the nature in the core of public policy. Never, as in this pandemic, health is in the core of the policies. I have more than 41 years of physicians, and this is the first time that I see something like this. So we need to take advantage of this situation. We need to increase public financing for health, but let's not forget the social protection. And I also fully coincide with you, Paolo, that I don't like to say expenditure. I always say investment, but we think that health is an investment. Another challenge is to coordinate efforts and initiatives to obtain universal, comprehensive, and sustainable health systems, together with the challenge of coordinating this with systems of social protection. And of course, everything else, everything linked to innovation, access, technology, science, and health sovereignty. It is important to have innovation in science and technology, but that reaches everyone. Negotiate capacities of intellectual property of manufacturers and the interests of the population. In the Andean Health Organization Equality Agreement, we will continue the effort to strengthen the cooperation and solidarity at every level, national, regional, global. Without solidarity, it's impossible to provide comprehensive responses, and we will continue working in partnership with the Pan American Health Organization. I would not like to leave before inviting you to our webinar 136, Defenders of the Planetary Health, Significant Experience from the Andean Region, this Thursday at 11 a.m. And I would also like to wish you, Paolo, the best of the best in everything what you would like to do. You've been so good for us to work together, and we know that from wherever you're going to be, you were always going to defend your values, your principles, and this commitment that we all have for health, for well-being, and for a dignified life of all our populations. Thank you very much for this forum. Good afternoon, good morning, depending who's listening to us. Thank you so much.